Okay, now let's continue their discussion for today. So we have to discuss now the complementary and alternative healing modalities. So I will just give you a heads up, guys, that some of the terms and concepts that are presented in this presentation are actually self-explanatory. So I don't really need to elaborate things because by merely reading the sentences, you can actually understand the topic. Okay, let's proceed. Let's discuss the Western medicine and the Eastern medicine. So how does it differ from each other, or what are the differences sa ilaha duha? Okay, when we see Western medicine is an approach to health that focuses on the use of science in the diagnosis and the treatment of health problems. Okay, so meaning Western medicine refers to like consulting to healthcare professionals, going to doctor for consultation, for ruling a diagnosis if your prognosis is poor or good. So it's like you are relying to science, and part of that is consulting to healthcare professionals like a doctor, uh, specialists like that. So in this chapter, conventional medicine, biomedicine, and allopathic medicine are used to describe Western. So here, kaning mga tulo na gipang mention, under na siya sa Western medicine. Mauni ang used to describe Western medicine. While sa Eastern medicine, it places greater emphasis on prevention and natural healing, like use of herbs, consultation sa mga kanang manghihilot, or somehow sa mga kanang mananambal. It's like believing on that way of healing. Complementary medicine, so it refers to the use of CAM together with conventional medicine. So along the way, as we go along with our lectures, we will be able to discuss this complementary medicines, their examples and their uses, and their purposes or their specific functions. And we also have alternative medicine, use of calm in place of conventional medicine. So if you have confusion, guys, you can actually look into your specific book. Try to go to chapter 19. If you have confusion, you can actually read the whole chapters if you want. So, systematize healthcare practices. So, now let's discuss the history of complementary medicine or the alternative medicine. So, we have here is Ayurveda. Ayurveda is the Indian system medicine and at least 2,500 years old. When we see Ayurveda, guys, it is a Sanskrit word that means science of life. So it emphasizes the interdependence of the health of the individual and the quality of social life. So meaning when we see interdependence, they have to work together for you to function effectively or for you to maintain your sense of well-being. Okay? So specific lifestyle interventions are a major preventive and therapeutic approach. So in this way of healing, this Ayurveda has prescribed diet and exercise program depending on the dosha or such thing that we call blood type. So a particular practitioner will provide you a specific diet plan and exercise program that will be based on your blood type. So this is actually originated from India, at least 2,500 years old na. Next would be traditional Chinese medicine. Okay, has developed over 3,000 years and is based on the premise that the body's vital energy, qi, circulates through pathways. So meaning it can be manipulated through specific anatomic points. So I know you've already done or you've done with your anatomy, or if I'm not mistaken, you have already taken anatomy and physiology last sem or this semester. So I know you have already vast information, or at least some information about the anatomy and physiology of the human body, so you're familiar with that. So in traditional Chinese medicine, the practitioner will going to manipulate some specific anatomic points of your body to facilitate healing, to ease pain, and to promote, to relieve anxiety, to promote healthy well-being. So, disease, according to the traditional Chinese medicine, disease is the imbalance of qi, okay? Practitioners of TCM are trained of ancient and modern therapeutic methods such as acupuncture. So, acupuncture, we will be discussing this later on sa atong slides. They are also using herbal medicine and massage, okay? Through massage, they will be manipulating some of your the specific points of your body that needs to be healed. Okay, next would be Native American healing. Okay, healers use medicine objects to assist them on ceremonial treatments such as singing, dancing, vision quest, chanting, healing touch, acupressure, and the use of herbs. So, mauna ang Native American healing. They viewed health as a harmonious relationship between your mind and your body. So your mind and your body should correlate with each other so that you will going to attain a sense of well-being. So next would be curanderismo. So curanderismo is a cultural tradition found in Latin America and among Latinos in the US. So healers are called curanderos, which is mga lalaki na siya, or curanderas, which are women. So utilize religious rituals, cleansing rites, and prayers. Next, let's discuss botanical healing. When we say botanical healing, it's the utilization of some herbs and some of herbal medicine. So the first one that we will be discussing is herbal medicine. So many prescription drugs sold in the US came from herbs. Okay, so since we are using US textbooks, so the some of the concepts here are based on US specifically. So herbs can also interact with other drugs, and caution should be used in combining herb with OTC's medication. So there are some questions in examination, guys, wherein they will going to the client will going to ask like, ma'am, I'm actually taking a herbal medication at this moment. Would that interact? Would that be possible if I will be taking some PO or some tablet in form na mga meds? Of course, you have to you have to refer it to the physician right away, because some of the herbal medicines naa sila'y kumbaga naa sila'y detrimental effect sa isa ka drugs. For example, nagatake og laing drugs ang patient, PO or tablets, dili sila compatible ang herbal medicine. So there are some instances na ingana. So that's why we have to caution our client, and we have to refer it right away to the physician if our client expresses na naa sila yung mga ginatake na herbal medicine. So prior starting another set of medication, we have to make sure na wala nagigingainom atong pasyente so that the patient will not put in danger. Okay? Next would be in page 325. This would be your activity for our fourth monthly exam. So you have to memorize the 10 types of herbs, their traditional uses, and the selected warnings. So you have to memorize that one because that will serve as our oral examination in this coming fourth monthly exam. So we will not be having a written exam. In lieu of that, we will be having an oral examination. So, dagdagan lang gyapon ako na. So, as of the moment, I want you to familiarize and try to memorize the 10 types of herbs, their uses, and the selected warnings, so the precautionary measures. You can actually locate that at your Fundamentals of Nursing book, page 325. Nakabox na siya, guys, nasa upper portion. Okay? So, we will have our oral recitation next week via Zoom, or maybe 2 weeks after na. So that madagdagan pa nato inyong topic for oral exam. Okay? Next would be aromatherapy. When you see aroma from the word itself, it's the therapeutic use of essential oils of plants in which the odor and the fragrance plays an important part. So chemicals are absorbed in the body, resulting in physiological and psychological benefits. So different oils stimulate, improve sleep, change eating habits, and boost the immune system. Caution is because some oils may trigger bronchial spasm. So, aromatherapy, ang iyang precautionary measure o iyang contraindication are those patients of us who are suffering from bronchial spasm or na mga asthmatic, ano mga pasyente. They are not actually um, allowed to engage to aromatherapy, okay? Next would be homeopathy, okay? Homeopathy is a self-healing system assisted by small doses of remedies or medicine. So natural healing compounds are prepared through a process of serial dilution and are taken orally. So the more substance is diluted, the more potent it becomes. So these topics, guys, are these interventions are actually common in US because as far as I've mentioned, we are utilizing US textbook. So some of these interventions are applicable here in the Philippines and some are not. So homeopathy is not actually applicable in our country. So sa US lang na siya. Next would be naturopathy, okay? Naturopathy is a naturopathic medicine is not only a system of medicine but also a way of life. And naturopathic practitioners do not provide emergency care or perform major surgery. So they are not allowed to do that. The goal of treatment is to restore health and normal body function rather than the application of one therapy. It's like their purpose is to restore health to a normal body functioning. Okay? So intervention include therapeutic nutrition, counseling, stress management, exercise therapy, and hydrotherapy or the utilization of water for relaxation and so forth. Next would be nutritional therapy. From the word nutritional, it consists of consumption of specific type of diets, supplements including vitamins, amino acid, herbs, fish oils to prevent or treat illnesses. So there are three major concerns here: the efficacy, consistency, and the safety of the client. Okay? Because not all herbs are harmless. Another concern is that supplements may can be contaminated with bacteria or any dangerous substances. And nurses must assess the client about the supplements and their known benefits and risks. Because not all supplements are actually okay for a patient. So we really have to assess the patient individually if that's particular supplements and vitamins is are actually suited for them. Okay? Next would be let's discuss manual healing methods. So we have here chiropractic. It's focused on the relationship between the body structure and mainly the manipulation is more on the spine and its functioning, okay? And they perform adjustment or manipulation to the spine or any parts of the body but most of the time ang spine ang target ani mga chiropractic practitioners, okay? So there are three primary clinical goals for this is to reduce or eliminate pain, especially for clients who are suffering from um, a vehicular accident or their spinal problem. So they need to go to this type of practitioner so that the spine will be realigned to its normal alignment. But somehow the purpose is to reduce or to eliminate pain. So either the two. And correct the spinal dysfunction since muscles and ligaments are strengthened by spinal rehabilitative exercise. So there are also some exercises specific for our spine. So ang practitioners for chiropractic lang ang allow mo himo ana. So, preventive maintenance to ensure the problem does not occur again. The second one would be from natural healing method is massage. So, massage is the scientific manipulation of the soft tissues of the body. So, it aids the body to heal by itself, increasing health and well-being. A skilled massage therapist not only stretches and loosens muscles and connective tissue but also improves the blood, the blood flow, sorry, and the movement of lymph fluid throughout the body. So, but of course, massage therapists should be trained. So, they should be trained significantly, and they have to receive appropriate training for them to perform the specific intervention towards the client. So, in the physical level naman, guys, it helps relieve muscle tension, reduce muscle spasm, lower BP, and promotes deeper and easier breathing. Okay? Now, let's proceed to acupuncture, acupressure, and reflexology. So, from the word acupuncture, it uses needles. Okay, acupuncture, when we say puncture, it's uses of needles. Well, acupressure in contrast naman is they uses finger pressure. Okay? These are techniques in which pressure or stimulation is applied to a specific points of the body. So the purpose naman here, guys, is to relieve pain, cure certain illnesses, and promote wellness. The third one would be reflexology is a form of acupressure most commonly performed on the feet, but also the hands and ears can also be manipulated. Okay, be familiar with the process. At the same time, the different methods to promote sense of well-being. These treatments are actually rooted in the traditional Eastern philosophy. Di ba, can you still remember the Eastern medicine wherein they are promoting natural healing method? Unlike from Western medicine, they are actually relying to science. Okay? When flow of energy is blocked or congested, people may feel discomfort or pain, frustration or irritability in emotional level. And the last portion or the last purpose will be lack of purpose in spiritual level. Okay? So that mao na siyang mga results if the flow of energy in our body is blocked or congested. That may lead to mawalan tag purpose when it comes to our spiritual dimension sa atong health. Next would be hand-mediated biofilm therapies. Well, the three most prominent are therapeutic touch, healing touch, and Reiki. So the use of hand on or near the body with the intention to help or to heal. So I don't need to elaborate to some of these topics, guys, because it's actually you can actually understand by just looking at this or by just reading the sentences. These therapies are helpful for people with variety of medical nursing diagnoses. So the mind-body therapies, guys, is yoga, meditation. We have yoga, meditation, hypnotherapy, guided imagery. We have qigong, tai chi, pilates, and so mao to siya ang ato ang mga mind-body therapies. So, si yoga, you're being familiar with yoga, has been practiced for 1,000 years in India. It includes ethical models for behavior and mental physical exercises for spiritual enlightenment. So, yoga session actually, guys, lasted 20 minutes to an hour. Okay? Next would be meditation. Meditation is the wide range of practices. So, of course, the purposes is to calm, the cope with stress, meditation, and of course, for spiritual inclination. So, most of the celebrities or mga Hollywood actresses actually uses or actually inclined to meditation. So, in that way, that would help them to cope with stress, to calm their nerves, and also for spiritual inclination. So it also improves stress coping abilities and protection against daily anxiety and stress. Hypnotherapy naman, guys, is the application for medical and psychological problems. So hypnosis, guys, is a state of altered altered state of consciousness. Okay, so naa ka sa state na altered imong consciousness. You are not fully conscious, okay? Your individual concentration is being focused and distraction is minimized. But of course, guys, you have to remember kasi may mga questions sa exam na kung ang hypnosis pa daw is are you aware of what is happening or you are not aware or not. But somehow here in our book, guys, when you are being hypnotized or you are under hypnotherapy, you are aware of what is going on. but you choose to focus on it and can return to the normal awareness if you want to. So meaning your answer would be you are aware of what is happening, but you try to focus on the treatment or the process, but of course you can actually return to the normal awareness. It can use with individuals who have problem with medical, surgical, or have psychiatric or psychological treatment. Session typically runs from 2 to 10 sessions. Next would be guided imagery. So imagery refers to a two-way communication between the consciousness and an unconscious mind that involves the whole body and is all of its senses. Guided imagery is a state of focused attention, much like hypnosis that encourages the change of attitude. The purpose naman here guys, to learn how to stop troublesome thoughts to help in relaxation. So the images may be created by the therapist based on the needs and the desires of the client. So the best on decreasing the symptoms. So somehow if the client is suffering from chronic illnesses, like they're suffering from a very for example, na sila sa in pain kay sila na state, they would love to go to get guided imagery because that what might help in decreasing the sign and symptoms, manage chronic illness, and also for preparation for any surgeries and childbirth. Next would be Qigong Tai Chi is like consisting of breathing, mental exercises combined with body movements. So, Tai Chi combines physical fitness, meditation, and self-defense. The continuous circular nature of the movements develops strength and endurance. So usually this is based in Chinese discipline. And some of the culture naman here in the Philippines, I don't know, I am not familiar with this type of treatment, but I'm sure that it is actually applied in America. I'm not just sure in here in our country. Next would be highlight. So it's a method of physical movement and exercise designed to stretch, strengthen, and balance the body. Actually developed by Joseph Pilates, a German national England out of the outbreak in World War One. So the benefits of this treatment is increased lung capacity to prevent atelectasis, somehow like that, to improved flexibility and joint health, and of course for better posture and balance. It can also help to rehabilitate the back, the knee, the hip due to stress injuries and relieve muscle aches. So this is actually also based on the principles of yoga. Next would be spiritual therapy. Okay, let's go to spiritual therapy. Faith and prayer. When you say faith, it refers to our beliefs and expectation about life, ourselves, and others. In religious context naman, when you say faith, it's like a belief in a supreme being. So it's a sense of letting go of the need to control while trusting and waiting for the movement when answers come. And part of spiritual therapy is under faith and prayer is prayer, of course. It's the most often defined as a simple form of communication and fellowship with our Creator. Because there are some instances in our lives that when we are praying, diba, we are being replenished. Parang we have that positive vibes. We are being, we can attain a sense of fulfillment when we are can get in touch with our Creator. Next would be miscellaneous therapy. We have this music therapy. It can be used in variety of practice setting. It can be used in relaxation. Diba guys, once we listen to music, we are it can calm our minds. It help us to relax. It help us to self introspect. We can actually reassess ourselves like that. So by actually listening to music alone, it reduces both pain intensity and distress in clients undergoing surgical procedures. But here in the Philippines, I don't know. So we are not practicing this, but of course, client can also listen to music after a surgery just to ease the pain or just to decrease the intensity of the pain. Next would be humor and laughter. So the ability to discover, express, or appreciate the comical and see the funny side of our lives has a physiological benefits that involve alternating states of stimulation and relaxation. Laughter, guys, stimulates the increase in our RHR and oxygen exchange. So, for example, our client are suffering from, of course, um, for example, they came from a post-op surgery. So, usually, or they are given with certain medication that decreases the respiratory rate or heart rate. So, they can use humor and laughter to facilitate the increase of the vital signs, which is the respiratory rate and the heart rate. Next would be bioelectric magnetics. It's the emerging science that study how living organisms interact with electromagnetic fields. So magnetic fields are able to penetrate and affect the functioning of the cells. So there are also contraindications such are but not limited to pregnancy, aneurysm. So aneurysm is like the repair of the brain. It's like they're trying to insert some clips in your brain or some implants if you have implants in your hearts, like you are actually taking some coagulant drugs, so it's a no for bioelectromagnetics. But next would be detoxifying therapies. Detoxifying therapies, it means the physical impurities and toxin must be cleared out from the body to achieve better health. So the first one would be hydrotherapy, the use of water. It's good for people who have prolonged fatigue, okay? Colon therapy, ginatawag ni siyang colonics. I know some of the clinics who perform colonics here in Philippines or here in Davao Oriental. It's based on the idea that high fat leads to accumulation of substance in colon, which in turn produces disease. That's why they try to clear out some fatty fats or mga fats that is actually accumulated in our body or in our colon specifically. So mawash out na siya, maybe that would also fasten the metabolism of that individual. So they wash the inner wall of the colon by water or some herbal solution. Another one would be chelation therapy. It's the introduction of chemicals into the bloodstream. Chelation therapy naman, guys, ginagamit na siya nga intervention or management once our clients are suffering from overdosage of that particular medication or overdosage of nicotine or some drugs, drug related toxicity. So chelation therapy is a process wherein the chemicals in the bloodstream will be washed out. Next would be animal assisted therapy. So it's the use of specifically selected animals as a treatment modality in health and human service settings. So the therapeutic horseback riding, okay, some of the mga economically stable na mga clients, they preferred horseback riding as a form of recreational activities at the same time that would also facilitate their healthy lifestyle. And the use of rhythmic movement of the horse to increase the sensory processing and improve posture balance and mobility. The last but not the least is horticultural therapy. It's also called gardening or healing garden. It's an adjunct therapy to occupational health and physical therapy. It stimulates five senses, provides leisure activities, and improve motor functions. So other would be thermal auricular therapy is considered with no benefit and poses harms. The thermal auricular therapy is actually being practiced in US but not here in the Philippines. But gardening naman, it's very as of the moment some of our parents or mothers specifically are actually enjoying horticultural therapy wherein they are being get in touch with the environment at the same time they are also enjoying their present lifestyle. So that would be the end of our topic for today. Let's discuss another topic for the next session or next week. If you have some confusion, you can message me or you can actually rewatch the video or else read your book. Okay, that would be all for today, guys. Thank you for listening.